flora. So another word is transient flora. That means it's not part of your normal flora. It came from somewhere else. Now your textbook author actually says some transient flora are going to become your normal flora. And that does happen. Let's say Jennifer and I are best friends. And we go around arm in arm and we hug each other and we share food and everything. She's going to acquire some of my normal flora and I'm going to acquire some of hers. And then we have a big fight and we don't see each other ever again, and I start hanging out with Anita instead. The makeup of my flora is going to change. You quit your job. You're going to lose some of the flora that you acquired on that job. Your new job, you might acquire new flora. They say about 10% of normal flora, everybody has the same. The other 90% are transient. They come and go depending on what your environment is, what you're doing, and what your biochemical makeup is. And maybe you changed your diet, you went vegan. It could change the balance of your normal flora. So on your test, you'll see a bunch of different words. I actually consider transient flora not to be normal flora. It's transient. It came from somewhere else. It got on you, it got in you. Hopefully your immune system's going to get rid of it. But there are cases where it will become your normal flora. But usually when I refer to transient, I mean it's not your normal flora. If it's one of these words, that's your normal flora. Okay. So the movie's called Outbreak, Commensals and Pathogens. Some of your commensals can even become pathogenic, right? They're also going to talk about not just bacterial infection, but one of the patients in the movie has a viral infection. And then they compare a viral diagnosis to a bacterial diagnosis. And I clicked out this little article. You know that program, The Doctors, with that handsome little doctor guy? He says, if you have had a sore throat and fever, along with swollen glands, without other common symptoms of a cold, such as a cough, you may actually have strep throat. But if you've been feeling unusually weak and fatigued, you might have mononucleosis. And that's exactly what this movie's about. One of the patients has strep throat, and one of the patients has mononucleosis. Strep throat is streptococcus, probably pyogenes, group A strep. Some are worse than others. Mononucleosis, what causes that? Virus, Epstein-Barr virus. All right, let's see if it'll play. Here we go.
How can I help you today?
It's my throat. It's really, really painful.
Got a bit of a sore throat.
Okay, when did this start?
These patients have recently become infected with disease-causing microorganisms. Both have presented with sore throats. We will return later to the possible microbial causes of this.
How's your appetite been?
But first, let us discuss the relationship between humans and microorganisms. The normal human body is not sterile, but is colonized by many billions of bacteria which cause no harm to the host and are referred to as normal flora or commensals. Commensals use the human host as an environmental niche. In return, they prevent infection by disease-causing bacteria by reducing their opportunity to gain space and nutrients on the surfaces of the body. Occasionally, the commensal bacteria can cause infection, particularly when some aspect of the host defense is compromised. Different sites on the body are host to different bacterial flora. Let's start with the skin. The skin is normally colonized by a range of bacteria, including Staphylococcus epidermidis, Corynebacterium species, Propionibacterium acnes, and enteric bacilli. These organisms are all adapted to the dry, acidic conditions found on the skin. One special area of the skin is the perineum. This tends to be colonized particularly by enteric bacteria such as Escherichia coli, derived from fecal contamination. Sometimes, enteric bacteria are able to cause urinary tract infection if they are introduced into the urinary tract, for example, by sexual activity. Likewise, Staphylococcus epidermidis, which is normally harmless, can cause infection, for example, in patients with IV cannulae or other indwelling catheters. The oropharynx is usually harmlessly colonized by alpha hemolytic streptococci, micrococci, Corynebacterium species, non-pathogenic Neisseria, non-pathogenic Haemophilus species, and spirochetes. For example, the alpha hemolytic streptococci, such as Streptococcus sanguis, can colonize the dental surfaces and will cause dental caries in people with poor diet and oral hygiene. Given the opportunity, these normally harmless organisms can also cause disease. During dental surgery, they can also be introduced accidentally into the bloodstream. This can be a problem if the patient has diseased heart valves, in which case the alpha hemolytic streptococci that have entered the bloodstream can settle on the abnormal heart valves, causing endocarditis. It is estimated that there are more than 1 billion bacteria per gram of feces in the large intestine. The overwhelming majority of these are anaerobes, such as Clostridium species and Bacteroides species. However, some aerobes are present, particularly the enterococci, Enterobacteriaceae, especially Escherichia coli, and Lactobacilli. These bacteria are very important in preventing frequent disease caused by ingestion of pathogens. When we give patients antibiotics, we can disturb this normal flora, and this may lead to the flourishing of harmful bacteria such as Clostridium difficile, which is capable of causing severe diarrhea. During abdominal surgery, any manipulation of the gut may result in surgical infection, particularly if the gut wall is cut. For this reason, patients undergoing abdominal surgery are given antibiotics to prevent the gut flora, including anaerobes, from causing disease within the peritoneal cavity or within the wound. The vagina is harmlessly colonized by Streptococcus species, anaerobes such as Bacteroides species, and Lactobacillus acidophilus, which prefers an acid medium and produces lactic acid, which keeps the vaginal secretions acid, thus preventing many pathogenic bacteria from establishing infection. These then are the normally occurring bacteria present in all bodies, which have a benign presence in the site they occupy. Certain microorganisms are pathogenic and are quite capable of causing disease when they make first contact with a human. Some microorganisms always cause disease when they infect humans. These include, for example, Vibrio cholerae, the cause of cholera. However, some pathogenic organisms can be carried by the human and may not cause disease, but can be transmitted to other individuals. A good example of this is Neisseria meningitidis, which colonizes the nasopharynx of about 5% of normal adults. Following colonization by this organism, a small proportion of individuals will go on to develop meningitis. Another example of asymptomatic carriage of a potentially dangerous pathogen is Staphylococcus aureus, which is an important cause of skin infection and can transiently colonize the nose. This organism can be inoculated from the nose onto the surface of the skin and cause abscesses or impetigo.
It's really, really painful. I hardly swallow. Really hurts when I try and speak.
Did you feel completely well last night?
I had, for 1 minute I was feeling cold, the next minute hot, and I'm shivering a lot.
This woman has recently become infected with a bacterium which has entered the throat and caused disease.
Tonsils or tonsils out?
No.
I'm just going to have to examine your neck, okay? Feel the glands and have a look in the back of your throat, okay? Let me know if it's sore anywhere.
Yeah.
Okay. I'm just going to have a look inside your throat. If you can just open as wide as you can. And just say ah. Okay, that's fine. It seems your tonsils are very swollen and you have streaks of pus on your tonsils, okay? Now we need to take a swab of your tonsils to see if we can send